Good day everyone, I'm Kathleen Williams and today I'd like to talk about the importance of infection prevention for healthcare workers. During the COVID-19 pandemic, it's important that the oral healthcare staff responsible for providing treatment take careful steps to protect themselves and their patients from infection. Treatment rooms should be very neat, with limited storage areas. Hand washing is an important step in preventing infection transmission. Staff should perform hand hygiene using an alcohol-based hand rub product or soap and water before putting on or taking off PPE and before and after treatment. Hands should be washed in running water for at least 20 seconds. In order to prevent the spread of communicable diseases, infection prevention and control are required in all healthcare settings. Infection prevention and control necessitate a fundamental understanding of disease epidemiology, risk factors that increase patient susceptibility to infection, and practices, procedures, and treatments that can lead to infections. When infection prevention practices are consistently and correctly implemented, they can reduce disease transmission and occupational exposures. An infection prevention program's primary goal is to reduce the risk of hospital-acquired infection, thus protecting patients, employees, health sciences students, volunteers, and visitors. Infection prevention and control practices are important in maintaining a safe environment for everyone by lowering the risk of disease spread. These practices are intended to reduce the risk of hospital-associated infections while also providing a safe and healthy environment for our patients, healthcare providers, and visitors. It is important to prevent and reduce the spread of infectious diseases in order to keep people healthy. People who come into contact with social care should have confidence in the cleanliness and hygiene of the services and products they receive. Providing occupational health and safety measures for protecting health workers is also fundamental for well-functioning and resilient health systems, quality of care, and maintaining a productive health workforce. Health workers face a range of occupational risks associated with biological, chemical, physical, ergonomic, and psychosocial hazards that affect the safety of both health workers and patients. WHO's work on protecting health and safety of health workers includes: first, development of norms and standards for prevention of occupational risk in the health sector. Second, advocacy and networking for strengthening the protection of health and safety of health workers. Third, supporting countries to develop and implement occupational health programs for health workers at the national level and in all healthcare facilities. The importance of infection prevention for healthcare workers. Infection Prevention and Control, or IPC, is a practical, evidence-based method for preventing preventable infections from causing harm to patients and healthcare professionals. Infection prevention and control is unique in the field of healthcare delivery because it applies to every health worker and patient at every point of contact with a healthcare provider. Infection prevention and control that is ineffective causes harm and even death. Quality healthcare delivery is impossible without effective infection prevention and control. It is impossible to achieve quality healthcare delivery without effective infection prevention and control. hand hygiene, surgical site infections, injection safety, antimicrobial resistance, and how hospitals operate during and after emergencies are all affected by infection prevention and control. Secondary infections can have a negative impact on health care delivery and medical hygiene standards in low and middle income countries, where infection prevention and control programs are especially important. By adhering to proper infection prevention and control guidelines, you will be able to reduce the likelihood of one of the most common healthcare complications, healthcare-acquired infections. A good infection prevention and control program will reduce risk not only for your patients but also for your employees. The global burden of healthcare-associated infection, or HCAI, is extremely high in terms of morbidity, mortality, extra costs, and other outcome indicators. This is especially true in developing countries, where public awareness of the problem is low and other health priorities frequently take precedence over patient safety concerns. According to the World Health Organization's 2011 report on the burden of endemic healthcare-associated infections, 7 and 10 of every 100 hospitalized patients in developed and developing countries, respectively, will acquire in healthcare-associated infection, provided that healthcare-associated infection is inherently linked to healthcare workers' behavior. Example, suboptimal hand hygiene practices, and in some cases, to healthcare system gaps. Example, lack of adequate equipment. This burden translates into a profound frustration and loss of trust in the system and healthcare professionals. As stated by WHO Director General Dr. Tedros Adhanom Ghebreyesus, no country, hospital, or clinic can keep its patients safe unless it keeps its health workers safe. WHO's Health Worker Safety Charter is a step toward ensuring the health workers have the safe working conditions, training, pay, and respect they deserve. Furthermore, the pandemic has demonstrated how critical it is to protect health workers in order to maintain a functional health system and society. Eventually, infection prevention and control will be critical among healthcare workers, particularly nurses. It protects both patients and healthcare workers from diseases that are considered preventable. To reestablish and strengthen public trust in our healthcare systems, the government must be reminded that it has a legal and moral obligation to ensure healthcare workers' health, safety, and well-being. Therefore, maintaining good hygiene at all times is important for healthcare professionals. In summary, it's important that oral healthcare staff take careful steps to protect themselves and their patients. Infection prevention and control are required in all healthcare settings. When infection prevention practices are consistently and correctly implemented, they can reduce disease transmission and occupational exposures. Health workers face a range of occupational risks associated with biological, chemical, physical, ergonomic, and psychosocial hazards that affect the safety of both health workers and patients. Infection prevention and control is a practical, evidence-based method for preventing preventable infections from causing harm to patients and healthcare professionals. Healthcare-associated infection is inherently linked to healthcare workers' behavior. This burden translates into profound frustration and a loss of trust in the system. I have now come to the end of my presentation. Thank you for taking the time to listen.